We interview other writers and we talk about mental health from their personal journeys. If you have not already hit that like and subscribe button, go ahead, do that now so that you never miss an episode. Hi, everybody. How are we doing today on this wonderful Tuesday? I kind of almost forgot what day it was because I've been off work for a couple days and then your week just gets all messed up. But it's Tuesday. I remember now. So welcome to the show, Lynda Williams. Hello, how are you?
I'm doing very well, thank you. How are you doing?
I'm pretty good now that I remember where I'm at in my life. Tell us a little bit about who Lynda is.
Well, first and foremost, I'm bipolar, and Linda is a writer. Um, I think maybe that's my most important identity, currently at least. I was born and raised in Quebec. I grew up on a
Oh,
dairy farm, and then when I was 19 years old, I moved to Alberta, Canada, so just outside of the
okay.
Rocky Mountains. I've lived here for over 20 years now, and here we are today chatting about my first book that's coming out in a few months.
Wow, that's cool. So, do you speak French then?
Arper, I've lost so much of it because I really don't have the chance to practice anymore.
I was going to say Alberta probably doesn't do a lot of French, but I mean, heck, I'm in Ontario. We don't do a lot of French. So, there you go. We're right beside Quebec. Unless I guess if you go north and then it's a little bit more because then you're more bordering Quebec than down here. But
Yeah,
anyways, um, anything else? Like, do you have any fur babies or anything?
I do have a fur son. He's 8 years old,
Aw,
mini Australian Shepherd.
I love it. What's his name?
His name's Cooper.
I love it. Yes, the most important part of who you are is what animals you have. Just throw that out there to the world.
Agreed.
All right, so you've already brought up the topic, so let's jump right in. Bipolar. When were you diagnosed?
I was 18 when I got my bipolar diagnosis, but before that, I'd already struggled with my mental health. And when I was 15, I was diagnosed as major depressive.
Okay.
And then I was prescribed antidepressants, which, as you may know, are not good for bipolar disorder if they're on their own or really at all. Yeah.
Yeah, and that's pretty common to be first diagnosed with a depressive disorder because most people, I don't know if this is your situation, you can let me know, but most people don't go seek help until they're in a depressive state, right? You don't go when you're feeling great, when you're in that manic. So it does take doctors a while to see that side of things or get all the information they need to make the appropriate diagnosis. Because if you're only seeking help in a depressed state, well, it totally makes sense. It's like, okay, you're depressed.
Yeah, and I'm bipolar too. So, I mean, you're hypomanic. You don't even realize that that's above and beyond normal. You really
Yeah.
think everybody has these moments, right, where they're an inch above the sidewalk.
Oh, I like that description of it. I'm a visual person, so I like that. Um, so for before we get any further, I guess. So for those who have not been with us for very long on the show, go back and watch all of our other episodes, obviously. But tell them a little bit about what bipolar is.
All right, so it's a mood disorder, and there's two types. Type 1, you're moving between depressive and manic episodes. And then type 2, you're moving between depressive and hypomanic episodes. And the difference between manic and hypomanic is almost like something on steroids, right? Like hypomanic is a little manic, but if you're manic, it's magnified hypomanic,
Hmm.
I would say.
I like that. And going back to your earlier description, you're an inch above the sidewalk, but like when you're manic, you're like a foot above the sidewalk or
Yeah,
more.
people recognize it more.
Yeah. So
Yeah.
again, harder to diagnose correctly, for sure. So leading up to, you said you were 15 when
Yeah.
you got the okay. So leading up to that point, how had things been? Why did you go to a doctor?
Oh, it was bad for a year before I finally went to a doctor. And I think the tipping point because my parents knew something was wrong, but at the same time, I was a teenager. They were expecting like moodiness and
Yeah.
I don't know, maybe a crying spell, right? So I got to a point where I just asked my mother, "What do you do when you don't know how to live?" And she was like,
Mm,
"I think we need to take you to a doctor."
yeah.
Yeah, so I saw a family doctor and she prescribed a medication that really affected me poorly, and I ended up in the hospital, and that's when I got diagnosed with major depression, and things went from there.
Okay, okay. And again, very common because it's mental illness is not cut and dry. There is no blood test. There is no like true test to definitively say this is what is going on. It really is a lot of here's how I feel, here's how other people say I feel. Like I know for especially with the young kids, but when getting my daughter diagnosed with autism, I mean it was you fill out this evaluation, have the teacher fill out this evaluation. She has to do a self evaluation, right? Because it's is this behavior across the board or is this behavior in a specific location? And so it's very tricky because they have so much information that they have to gather. And that's, any kind of disorder, like with bipolar, if you're only seeking help when things are bad, then they have a lot more information they have to gather.
Yeah.
So going from that point, when you got diagnosed with the depressive, how did it go from there to actually getting to 18?
So a couple of things happened. The first thing that happened is I would start on a medication, an antidepressant, and things would be great. I would get a little hypomanic. I didn't think anything was wrong. I thought, things are improving, everything's going to be fine from here on out. And then I would hit a plateau and they would increase my dose a little. And then
Mhm.
things would be great again. And then I would hit another plateau and then they would change the medication because things weren't
Yeah, it wasn't
quite going the way
working.
they're supposed to, but they weren't getting the full picture of Lynda doing a little too good. And in that time, my mother was going through perimenopause and she was diagnosed with bipolar disorder.
Okay.
And then it was just, it, it came to be obvious that, this is the pattern we're seeing. It's
Mhm.
in the family, it's very hereditary. So, yeah, just everything fit together.
Yeah. And again, when you have that fuller picture, and it's, I think, becoming a little bit more common now because people are starting to get diagnosed even at their later ages. Because there's more research, things that know more, a little bit more, and we're more vocal about wanting help
Yeah.
than previously. And so it does make it easier then for our kids and our kids' kids and so forth to have that medical history. It doesn't always mean that you have it. By all means, you a parent can have something and a kid doesn't, but there are a lot of things that are hereditary, and so having a fuller picture, just like when they ask you, is there a history of cancer? Is there a history of mental illness? It gives that fuller picture, which is so much better for the doctor.
Absolutely, yeah.
So, um, how did you like you said that your mom was diagnosed. So how long from then to when you they figured it out for you did that go?
It was less than a year. I remember I was
Okay.
17 when she got her diagnosis, and
Okay.
then I was 18, and they were shifting me from pediatric care to, okay, now you're an adult. You're going to have a new doctor, and they were looking at the information from someone who was seeing it for the first time, and it was very obvious, I think, at that point.
And sometimes that fresh pair of eyes is helpful too because they're looking at it in a different viewpoint, which is sometimes nice. Like it's great, I would say, um, with therapy. I love having the same person because I don't have to retell a story or whatever. But occasionally it is nice to go to somebody else and say, here's the situation. And they go, have you considered? Because they don't know you. I'm not saying you have to go do it, but it can be a nice little different take on a situation.
Yeah, those words, have you considered, very important.
Right? Okay, so then once you got your diagnosis, first off, how'd you take it?
Oh, not well. And it's interesting because I mean, I already had a mental health diagnosis. So what should be the difference between one and the next. But the thing I got hung up on was this is for the rest of my life. I
Hmm.
thought this was a hill I was going to climb and a story I was going to tell, and I was going to put it behind me. And then I had to come to terms with this, that you're never letting this go. You're carrying this like a purse and you're never going to put it down, right?
That's a good way to describe it, actually. I'd never considered that before. So then, how did you come to terms with it?
Oh, I put it off. I was bad when I moved from Quebec to Alberta. I moved with 6 months worth of medication. I did attempt to find a psychiatrist here, and then hmm, I decided maybe I'm not crazy. Maybe everyone else is crazy. Yeah, so that did not end well. And I ended up going back to see a doctor a year or two later. And she found me a psychiatrist and a therapist. And I have been behaving since then.
That's good. And again, very common. Been there, done that in regards to, well, I don't need this anymore. It's fine. It's not. So yeah, it's very common to have that kind of feeling that it's everybody else, or I'm okay now, so now it's fine. I don't need to go do that. But it gets worse.
It certainly does.
Okay, so how has it affected like your life? Has it had a big impact? Are there certain things that you need to be careful of?
Yeah, it's had a huge impact, I would say. And there's so many things I need to be mindful of, like sleep. That's a big one for me. If I get a short night, like 3 or 4 hours, for whatever reason, if I'm sick, I don't function as well, and I can almost time how long it's going to take for me to have an episode or an
Mm,
outburst in terms of my mood. I have to be careful with alcohol, for sure. It's another one. Just even with stimulation, right? Like I get overwhelmed fairly easily. So I do have to pay attention to how much I'm putting on my plate. It's
mhm.
impacted work in terms of executive function. There are times when I really, really struggle with that. And that's something that, regardless of what position you're in, what kind of a job you're fulfilling, you need executive function at work. You just can't get around that.
Yeah. And that's, I mean, not just at work, but in life, you need that. So, again, not everybody knows these terms that we're using. They might be new to the show. Explain to us what executive function is.
That's how you put together multitask activities. Like when you need to
It's a good description.
prioritize stuff, you need that part of your brain. I don't even know which part of your brain it is.
Yeah, I
Do
don't know
you?
either. Trying to think. I probably knew at some point in my life, but I
Maybe
do
it's the
not know.
frontal lobe. I don't know. You just
Oh.
look it up to be certain. Don't trust Lynda on this. She didn't take psychology. But yeah, you need to be able to prioritize. Like driving is something that you need executive function to do, and it can become like second nature to you.
Mhm.
But in order to learn, and I don't drive, I've had a learner's permit for over a decade, you do need executive function.
Mhm. Yeah, there's, I mean, a great description. So just expanding on that, things like, and you've said it, organization, but your time management, just understanding the concept of time. That's something that my kids struggles with in their executive function. If I say, in half an hour we're leaving, well, what the heck is half an hour? Like, yeah, okay, if I'm looking at a clock, I know from 1 to 1:30 that's half an hour, but like, what's half an hour? Whereas a lot of the rest of us might go, okay, half an hour, I know that I can get dishes done and put the laundry in that time, right? So it goes together with different things. Other executive functioning, knowing that you need to go shower, knowing that you need to go and brush your teeth, and having the oomph to go do that because you know it needs done, so you're gonna go do it. So those are just, a few little examples to add on.
Yeah, and to build on that, it takes so much energy. Like sometimes people wonder why you're always exhausted if you have a mental health issue. And if you have to talk yourself into the shower, if you have to think about all these things that other people just automatically do, it takes
Hmm.
a lot of energy.
Exactly. There's a couple that I follow on TikTok. Now I'm trying to remember. Rocks and Rich, maybe? Anyway,
Oh, yes, I know they're British, right?
yes, and they are fantastic at explaining these things. I absolutely love their descriptions of them. And the one time specifically, this made me think when you were talking, there was a list of like tasks, and it was like, hey, when you finish these, so it was Rich talking to Rocks, when you finish these, you get your Kinder egg or whatever, Cadbury egg. She's like, ooh, Cadbury egg. She goes, but that's a lot. He goes, what do you mean that's a lot? Clean the bathroom, put your laundry away. That's not a lot. She goes, let me explain clean the bathroom. So clean the bathroom is not clean the bathroom. And this is what gets me. And I'm like, oh my gosh, the way that you explain it, this is my life. I love this. And it's helped me a lot because then I don't feel so bad about myself. So clean the bathroom is get the materials to clean the bathroom, walk up the stairs, at least, depending on your house, but go there. Um, then you have clean the sink. You have clean the counter. You have put the stuff in the toilet, wait for it to do its thing, and then brush the toilet. And then you have the outside of the toilet. And then you have right, like, it's not one task. It is many, many small tasks. Even just put the materials away when you're finished cleaning the bathroom. Like, it's a giant task. So it's simple for some people, but it is actually many, many tasks that is often considered one thing when it is not one thing. And that, again, goes back to executive functioning. It's breaking things down into these little itty bitty type tasks, bite size, so that we can maybe accomplish something and do something. And yeah, if you want to know more about that stuff, they explain it in just like a fun way. Highly recommend.
Yes, they are amazing. And it makes so much sense to me because if I think about my bathroom, why is it that only certain things are clean? Because
Yes.
I only finish some of the jobs, right? And then part of me says, well, you know what? As long as your toilet and your sink are clean, those are the main things. But honestly, my mirrors, I'm telling you, they're scary.
Right.
Yeah.
Right, exactly. Or it's like I wipe off this part of the counter because I don't want to move the things to actually wipe over there, but it actually does need done.
Yeah.
Yeah. So yeah, breaking down those tasks is super helpful, I think, when we start changing the way our brains think. And that was something actually my therapist had to help me with because I was always like, it's all or nothing. She goes, but
Mhm.
why? And I'm like, I don't know why. It just is. And she's like, it doesn't have to be. I have never considered that before. Going back to, have you considered?
Mhm. Magic words.
Right? So it's pretty cool when you start to break stuff down and readjust your thinking on things.
Absolutely.
Um, so going back to bipolar, this is I like to get off track, but it was good. It was a good conversation.
Absolutely.
Um, so you said you struggled with the diagnosis, and then when you finally decided to go back and reach out for help again, um, my guess is it was a turning point for you.
Absolutely.
And so tell me a little bit more about that. Like, how did that go, and how were you feeling reaching back out?
I was reluctant on the therapy part. I was like, okay, with the medication, I'd already done medication. I knew how much it could help. So I wasn't skeptical about that. And I was lucky that the first medication the psychiatrist put me on worked. I'm still on it today. So there's that to be grateful for because trying different medications can really be exhausting too.
Yes.
But the therapy part, because I talked to therapists before and I'd had kind of a mixed bag experience where I don't know, I had my doubts about how much it was helping. And I don't think I understood that it was kind of a team sport, that, if you were holding
Hmm.
something back, your therapist can only help you so much, right?
Mm-hmm.
So I met this lovely therapist and she just changed my life. And part of it was she could tell I didn't really trust the process. So she actually talked some about herself. I've never had this happen before where a therapist talked about the fact that they had 4 kids or that their husband died prematurely because he wouldn't see a doctor,
Hmm.
and just these very personal things about her life. And she didn't make the whole session about her, but she gave me a reason to trust her.
That's
And
huge.
very huge. And in turn, I became more open and honest and willing to work with her. Yeah.
Right? And that's what it comes down to is you might not find a therapist you like right away,
No.
but keep trying. And yeah, finding that one that you can trust that makes you feel like you can open up and share, that is a breakthrough. Again, another turning point when you can find that person.
Yeah. It's amazing. I'm so grateful I was paired with her. It just, yeah.
Fantastic. I love that. So speaking of therapy, what are some of the most useful strategies that you were given or things that stand out?
One of them I was just thinking of because we were talking about executive function. I was told, if you feel like something is too big of a job, just start. Time yourself.
Mm.
Give yourself 2 minutes at it. If you can't stand doing it after 2 minutes, go ahead and stop. But if it's something like the dishes, you see all the dishes piled on
Oh,
the counter.
yes.
Okay, give yourself 2 minutes at it. Once you've got the sink full and your arms are in the suds, I've never had it happen where I didn't finish them, right?
Yeah.
So there's the starting hurdle, which I think, especially if you're a bit of a perfectionist, can really
Hmm.
trip you up. That was really good advice. See, there's so much gold I've gotten over the years. I
Oh, you
think
gotta.
giving yourself grace, though, is another one.
That's a
Um,
very popular one.
yeah, just because some days aren't going to be great, that's part of the journey, right? You have to accept that some days are going to be difficult. Some days you're the pigeon, some days you're the statue. Yeah,
I
it's a big
like that
one.
example. First, when you said the pigeon, I was like, what? And then you said the statue. I'm like, oh,
Yep.
I like that a lot.
Yeah,
I'm stealing it now.
excellent.
I'm like picturing a little cartoon, and there's like a pigeon, and the statue is like, "Who are you today?" Um, and there's like poop falling in between the two of them, obviously, in my little vision. That who knows? Maybe one day I'll attempt to draw. I don't know. I'm not the greatest at that. Maybe I'll get my kid to do it. Anyways, um, but that is a super popular piece of wisdom that has been shared is giving yourself grace, and I am personally getting better at it very slowly, baby step wise. And I think that's important to note is that baby steps are okay because it's still forward.
Yeah.
um so what would you tell somebody right now? What would be your piece of wisdom for them if they are kind of, if you think back to when you were starting to feel maybe not so good, but then those little bit of moments where you felt fantastic and then not so good, um, and the person was like, I don't know, I'm fine. Everyone's like this. What would be your piece of wisdom to them?
That's a good question. You know, I think if you have to ask yourself, am I okay? It means something's up, right? If you're questioning it, seek help.
That's a great one, actually. That in over 200 episodes, I don't think somebody said that one. So
Okay.
that's why I love talking to people. Because, yeah, but that is great. If you are, am I all right now? And that's the same thing. I always like to go, when we're talking about mental health, well, if you're looking at, a spot on your hand, you go, huh, is that an okay spot? You tend to go to the doctor. It's the
Yeah.
same thing if you're going, am I okay right now? Go to the doctor.
Yeah.
Um, all right. Is there anything else that you feel that you need to share regarding this topic?
Oh, I think we've had a really great conversation. I don't think we
Right?
need to add to that. Oh.
Yeah. I mean, maybe one day because I feel like obviously there's more, but I feel like we've done a lot. So you said your first book is coming out.
Yeah. September 1st, it's a collection of
Mhm.
short stories titled The Beauty and the Hell of It. And
Okay.
it's about women coloring outside the lines.
Okay, Yeah. I always forget that I have little noises I can use. So,
That's amazing. Thank you.
anyways,
Yeah,
women coloring
so
out of the lines.
yeah, many of them are dealing with trauma or mental health issues, and they're coming to terms with it, and resisting expectations about how women should necessarily behave. Because I think when it
Okay.
comes to like grief and trauma, there's a narrow vision of how we should handle it and how long it
Mm.
should take to handle that sort of thing.
Yeah.
Yeah.
Oh, I like that. So what genre do you think it kind of falls in then?
First and foremost, I would say women's interest, and it's on the cusp of literary fiction. Like, I feel like I straddle popular and literary.
Okay, very cool. And you said September 1st, right?
Yes.
Is it on pre-order now or
It
soon?
is on pre-order. You can get it on pre-order at a local independent through Amazon or Chapters in Indigo.
Nice. And what was the title again?
The Beauty and the Hell of It.
I love that title actually. Like I really do. It's very catchy, right? Awesome. And so yeah, guys, go pre-order because then you have it right away. I always pre-order stuff I want to read because then it's like right there when I want it. Actually, sometimes I sometimes I forget I've pre-ordered something and then it shows up and I'm like, oh, this is so exciting right now. It's like a present. I know I paid for it, but it's like a present because I didn't remember.
It's the best feeling, right? It's a little Christmas surprise in September.
Right? I love it. And where do people follow you?
They can follow me on Instagram, Lynda Williams underscore author, and they can check out my website, www.lindawilliams.ca.
Because
And
we're
those are the main
Canadian.
ones. Blue Sky is starting to burgeon, but it's not what Twitter was in 2009. I don't
Okay.
think.
No, no, definitely not. Well, thank you so much for being on the show.
Thank you for having me. It was lovely chatting, and yeah, I'll be checking out your show on a regular basis.
Well, thank you.
All right. Take care.
Just wanted to use that cool other transition. I didn't know what it
Oh,
sounded like. Ready, ready, let's listen. I'm just playing, guys, just playing as we say goodbye. So, of course, thank you everybody for listening. These are always such important topics. Remember, it is Mental Health Awareness Week, um, but it doesn't stop this week. It goes on forever and ever and ever. And hit the like and subscribe button if you have not already, because I don't know why you wouldn't have. That would just be sad. Crying face. I don't know. Maybe there's a crying thing. I don't know. There's a laughing one. Um, and remember, the only way to end the stigma of mental health is to speak openly and honestly. Bye.